Good afternoon. This is Rudy Owens. I'm a public affairs specialist with the Oregon Health Authority's Health Information Center. Thank you for joining us today for our Facebook Live presentation on rising COVID-19 cases in Oregon. Today, we're joined by Dr. Tom Jeanne, Deputy State Health Officer and Deputy State Epidemiologist at OHA. And we're also joined by Dr. Paul Cieslak, Medical Director of Communicable Diseases and Immunizations for the Public Health Division at OHA. After their brief presentation, we will open it up to questions. To ask a question, you'll submit it in writing in the chat section. And with that, we'll ask Dr. Cieslak to kick us off.
Over the past several weeks, COVID-19 cases, COVID-19 related hospitalizations, and the percentage of people testing positive are now increasing after all of them were falling a month earlier. Daily cases and hospitalizations are now higher than the projection in our most recent modeling report. Here are just some of the examples we're seeing. First of all, cases. On July 1st, our 7-day moving average of daily cases was 180, which at the time was a 45% drop from the previous month. Nearly 4 weeks later, on July 27th, that average more than tripled to 565 daily cases. On July 8th, OHA reported 1,189 new cases of COVID-19 during the week of Monday, June 28th through Sunday, July 4th. That represented the lowest weekly case count in more than a year. Yesterday, we reported 3,098 cases of COVID-19 for the week of July 19th through 25th, or a 160% increase in just 3 weeks. Hospitalizations. Our data show COVID-19 hospitalizations are headed the wrong direction as well, with an extremely steep increase over the past 3 weeks. On July 9th, there were 106 people with COVID-19 related illness in Oregon's hospitals. Yesterday, there were 292. That's a 175% increase. Over the same time period, the number of COVID-19 patients filling intensive care units increased from 28 to 89, more than triple the number. Finally, more Oregonians are testing positive for COVID-19. The week of June 28th to July 4th, the percentage of positive cases from tests was 2.9%, down from 6.8% in early May. 3 weeks later, that rate is now 5%, a 72% increase. However, these adverse outcomes are in general not happening among residents who have been vaccinated with a COVID-19 vaccine. They're happening chiefly among Oregonians who aren't vaccinated. On July 1st, we posted our most recent report on breakthrough cases in June, that is, among people who were vaccinated. We define a breakthrough case as someone who tests positive for the virus 14 days or more after completing their vaccination series. 92% of the 7,241 COVID-19 cases reported in June were among people who are not fully vaccinated. In other words, only 8% of cases in June were breakthrough cases. More than 9 out of 10 COVID-19 associated deaths for that month were among people who were not fully vaccinated. Vaccination remains by far the best way to protect yourself against COVID-19 and to keep the virus from spreading. Nothing is 100% effective, but the more Oregonians who are vaccinated, the less likely we are to see cases, hospitalizations, and deaths from COVID-19. And for Oregonians who live in communities where vaccinations are lower, the threat of COVID-19 remains large. This is for 2 reasons. First of all, with the state of emergency and many restrictions expiring on June 28th, Oregonians have largely taken their masks off and are socializing much more. Second, the rise of variants that are highly transmissible, that is, more contagious, especially the Delta variant, has only increased risk for these areas. Adults and teens not yet vaccinated are still vulnerable to serious illness and are at risk of passing the virus to someone who could be hospitalized or worse. The Delta variant, like several others identified by researchers, spreads more easily and quickly than most variants. It spreads from one person to another more than twice as easily as the earlier strains did. It is causing some vaccine breakthrough infections, and though most of these cases are mild, it's clear that sometimes they too can spread the virus to others. Oregon, like many countries and other states, is seeing the impacts of the more transmissible Delta variant. It is now the dominant variant circulating in Oregon. Since July 11th, 63 of 68 strains sequenced in Oregon have been Delta. That's 93%. New data from researchers also show that persons who have been infected with Delta have higher viral loads. They have more virus in them than found in previous variants. And this translates to more cases of COVID-19. More cases can result in more hospitalizations, putting greater strain on healthcare resources, and more cases lead to more deaths. The good news is that the studies have shown that the currently authorized vaccines work on the circulating variants, including the Delta variant. The bad news is for unvaccinated Oregonians, you're at even higher risk now than when the pandemic was raging a year ago. And if you're infected, you could more easily infect and harm others. I'm now going to turn it over to Dr. Tom Jeanne.
Thank you, Dr. Cieslak. Many of you may have heard the new recommendations that OHA shared on Tuesday. In response to the large jump in cases and hospitalizations in Oregon and new national guidance issued by the Centers for Disease Control and Prevention, calling for masking measures to prevent the spread of the highly transmissible Delta variant, the Oregon Health Authority is recommending mask use in public indoor settings throughout the state to protect Oregonians from COVID-19. On Tuesday, the CDC recommended that fully vaccinated persons in parts of the United States where there is substantial or high transmission of COVID-19 should return to wearing masks indoors. This followed new research on the Delta variant and the spread of the virus in areas with lower vaccination rates. The CDC's goal is to help drive down transmission and get more Americans vaccinated. When Oregon reached the benchmark of 70% of adults being vaccinated at the end of June, the state lifted most restrictions, but OHA continued to recommend that Oregonians wear a mask indoors and in outdoor crowded settings to protect them from COVID-19. In response to the large jump in cases and hospitalizations and a new national guidance, we are now recommending universal mask use in public indoor settings throughout the state. That does include fully vaccinated Oregonians. The use of face masks provides significant protection for individuals who are unvaccinated, as well as an additional level of protection against the small risk of infection for vaccinated individuals. And just today, Governor Kate Brown directed OHA and the Oregon Department of Education to create a rule to require masks indoors for K-12 schools statewide for the upcoming school year, in line with CDC's recently updated guidance. This is important to ensure children can return to full-time in-person learning this fall with minimal disruptions. Because many children are not yet eligible to be vaccinated, masks are crucial to keep our kids safe in the classroom. Again, without a doubt, the best protection against contracting the virus is getting vaccinated. The COVID-19 vaccines are safe and they are effective. They were exhaustively tested in clinical trials, and their effectiveness is reflected in the data here in Oregon. OHA is working with our local public health partners who are managing the response in their jurisdictions. We've called on local leaders to redouble their efforts to increase vaccination rates, and these local level efforts are more likely to be effective in reaching unvaccinated Oregonians than state level mandates. The current recovery order signed at the end of June by Governor Brown does not prevent our local governments or school districts from using their authority, including requiring masks or physical distancing. Locally driven response efforts are what is needed at this stage in the pandemic and are key to protecting the communities with the most COVID-19 illnesses right now. OHA is also working to close the vaccination gap for communities of color, which have suffered disproportionately from COVID-19. We're focusing on increasing equitable vaccination access to achieve a goal of 80% of adults of color vaccinated. And OHA is supporting both rural and urban areas wherever efforts could have a high impact on communities of color. Our local partners will play an important role in encouraging unvaccinated people to get the shots to help promote local vaccination efforts and to work with local businesses to help their workers get vaccinated. OHA is supporting efforts by sending more vaccine doses as needed, helping with case investigators and contact tracers, and providing COVID-19 testing. OHA will also continue to work with our local public health partners to schedule more vaccine clinics and conduct outreach in their communities. And with that, we're anxious to get into your questions.
Thank you, Dr. Cieslak and Dr. Jeanne. And as a reminder to our audience, we're only taking questions today on rising cases. Our first question today is from Carrie. With hospitalizations and cases rising, why aren't we putting restrictions and not just recommendations back in place?
Well, I can take that one. Thank you for the question, Carrie. And it's a great question. What I can say is we are moving really quickly to address the concerning rise in cases and hospitalizations, as well as the rapidly spreading Delta variant. And we believe the strong recommendation for all people to wear masks in public spaces indoors will have a significant impact on slowing spread. And as the governor just announced today, there will be a requirement that K-12 students wear masks indoors in classrooms this fall. So we'll continue to evaluate trends, possible approaches statewide that could help prevent transmission and prevent another large wave of COVID in this fall and winter. That could include restrictions if necessary, but at this time, these are the steps that we're taking.
Yes, and Tom, let me add that to the requirements that the government has instituted, localities can adopt additional requirements based on their local circumstances.
Thank you both, Dr. Cieslak and Dr. Jeanne. Our next question is from Melissa. Of the new cases, how many of these people were vaccinated and how many were unvaccinated?
Well, I'll take that one. Our most recent report was the July 1st report, and 92% of the cases were among persons who were either unvaccinated or incompletely vaccinated. We're all eagerly awaiting the report on the July cases, which should come out in the first week of August. So we'll have updated numbers on that.
Thank you, Dr. Cieslak. Our next question is from Warren. With cases rising, will OHA consider reinstating the reporting of cases on the weekends?
Yeah, thanks, Warren, for that question. Unfortunately, at this time, we really don't have the capacity for weekend reporting, but I can say that we will, of course, continue to evaluate trends and the need for more frequent reporting in general.
Thank you, Dr. Jeanne. Our next question is from Kathy. And Kathy asks, are you still counting by tests and not people? And the breakthrough cases mean they now have antibodies and don't need the vaccine?
I'll try to answer that, Kathy. Thank you. Well, what we report are cases, and those represent individual human beings who are infected with the virus. So we do count how many tests are done, and we look at test positivity %, but the case counts that we're reporting are individual people who are infected. The breakthrough cases, all that means is that these are people who are at least 2 weeks out from completing their vaccination series. We don't know how many of them responded to the vaccine and made some antibodies, but not enough to protect them, and how many simply failed to respond to the vaccine, or even how many initially responded but had their antibody titers wane over time. All we know is that they were vaccinated, and despite that, they came down with COVID-19.
Thank you, Dr. Cieslak. Our next question is from Stephanie. She asks, do you expect schools to be in person and stay open through December?
Yeah, thanks, Stephanie. That's kind of $1 million question, but I will say that the governor has expressed a strong desire to have all kids in school in person 5 days a week this 2021-2022 school year. And I would say, we can't predict the future, but we have a pretty good sense that we've got a lot of measures that do work in schools. And schools, despite having a lot of students from different families and areas coming together, schools are pretty structured places. And the Oregon Department of Education and all the schools and school districts around the state have really done a fantastic job of implementing preventive measures, everything from screening questions for symptoms to keeping daily logs to hand hygiene, hand sanitizer, disinfection, ventilation, and of course, the really important ones of masking and physical distancing. So, even if we do see a continued rise in cases this fall, I think with the requirement that all kids are wearing masks and teachers and staff as well, with increasing numbers of people being vaccinated, we do hope that children under 12 will get the green light to be vaccinated in the coming months. With all those things in place, I think things actually look pretty good for having a lot of schools in person through the fall, but time will tell.
Thank you, Dr. Jeanne. Our next question is from Lisa, and Lisa asks, should a teen who has already had COVID get vaccinated?
I'll take that one. You do get some immunity from an episode of COVID-19. It varies from person to person. And the problem is that we know that at least in some people, it doesn't last for all that long. And so people can get reinfected. We do have, persons who have been infected more than once have been reported to us. And we also know that if you've been infected and you get vaccinated, you mount a really good immune response to it. So we definitely recommend that people get vaccinated, even if they've already had COVID-19. And we know that it's safe to do so.
Thank you, Dr. Cieslak. Our next question is from Megan. Megan asks, can you define indoor public spaces?
Good question. Yeah, I'll take a first pass at that, Megan. So again, this is a recommendation. So I don't think indoor public spaces has been defined, down to every single possible setting. I could be wrong on that, but I think in general, this is going to refer to places that we kind of think of as public spaces. So whether it's a supermarket, a store, any place where people from outside your friends or families are able to be indoors together. So it wouldn't apply to a private home, for example, if you had some people over. However, again, remember that smaller gatherings are safer, outdoors is safer, and even if you've all been vaccinated, it might be wise to wear masks indoors if you have a lot of people coming over to your house, for example. But in general, that recommendation applies to the public spaces that we go to on a daily basis, like stores and shops.
Thank you, Dr. Jeanne. Our next question is from Pam, who asks, why should healthy people wear masks?
We know that masks are good at, if you get COVID-19, that you're shedding a lot of virus from the nose and throat, whether you have any symptoms or not. So you may feel healthy and already be infected with COVID-19, and wearing a mask is really greatly reduces the amount of droplets that you put out, even with talking. And so you can protect other people that way. And if you're around somebody else who has COVID-19, we certainly would hope that they are wearing a mask at the time, but you can increase your protection by wearing one yourself to prevent inhaling any of those droplets that the other person might have put out.
Thank you, Dr. Cieslak. Our next question comes from Jonathan, who asks, which vaccine should I get?
Well, all of the vaccines provide excellent protection against severe disease. And so we're not expressing any preference for one vaccine or another. The data varies slightly and the trials were conducted in slightly different populations, but they're all very good vaccines.
Thank you, Dr. Cieslak. Our next question comes from Chris, who asks, are there any recommendations for vaccinated persons meeting indoors? That is, can an asymptomatic vaccinated carrier pass it to another vaccinated person?
Unfortunately, the answer to that is yes. We're seeing a lot of data come out from, well, for example, there was an outbreak in Provincetown, Massachusetts, with cases among vaccinated persons. And also there are data from Israel coming out from cases among vaccinated persons, and they too can have very high viral loads. And so there is still some risk there, unfortunately. The good thing about vaccines is that you are less likely to be infected, and you're much less likely to land in the hospital from COVID-19. But if you are unfortunate enough to contract COVID-19 despite having been vaccinated, you could be shedding a lot of virus and transmit it to others.
Thank you, Dr. Cieslak. The next question comes from Michelle. And Michelle asks, will updated recommendations get ignored? That's in parentheses, be coming out for daycare providers. How are we protecting our vulnerable kids who can't be vaccinated?
Thanks for the question, Michelle. So, our colleagues here at OHA have worked closely with the Early Learning Division, which kind of oversees childcare and daycare throughout the pandemic, to really work on guidelines and requirements to really ensure that vulnerable children are protected. They did update their guidance, I think, last month. And I believe, like everything we're doing right now, we're continuing to reevaluate based on the trends and based on the epidemiology that we're seeing with the Delta variant and our rising cases, what needs to be done for different sectors. So I don't know for sure what might be in store for daycare and whether requirements may be coming. But I think protecting that very vulnerable population, is important. One of the most important things, of course, is physical distancing and masking. And yes, small children may not be perfect at that, but generally children over the age of 2 can wear masks effectively, and wearing a mask at least as much as possible is better than much better than nothing. And then, of course, many of the staff, or almost all of the staff in these settings, are able to get vaccinated and help protect themselves and prevent spreading. So thanks for that question.
Thank you very much, Dr. Jeanne. Our next question comes from Kim. Kim asked, as schools open shortly, will OHA please start reporting the breakdown of unvaccinated that are getting COVID between 12 and over 12?
Thanks, Kim. That's a good suggestion. It's something we can look at and discuss with our epidemiology team and with education partners. We're all excited for that day when younger children can get vaccinated too, and we'll definitely want to keep an eye on how many breakthrough cases we're getting. But again, we have every indication that even with the Delta variant, vaccines are highly effective, and the vast majority of cases are not breakthrough cases. They're cases in unvaccinated adults and children.
Thank you very much, Dr. Jeanne. The next question comes from Amy, who asks, if you have tested positive for COVID-19, can you get it again, even a third time?
Well, we do know that some percentage of people who contract COVID-19 can get it again. We call that a reinfection. We think it's pretty unlikely within the first 3 months after infection, but eventually the immunity that you developed with the initial infection can wane and you can be susceptible again. And I suspect that is especially true, among people who have immune compromising conditions, who don't mount good immune responses. It's not all that common, by the way. I have heard of many people getting a reinfection. I've actually never heard of anybody getting infected a third time. But I suspect it could happen to people who don't mount good immune responses to the viral infection.
Thank you, Dr. Cieslak. Our next question comes from Alita, and Alita asks, what are your recommendations on clean masks? Many kids don't have access to clean masks for school and are afraid to take theirs off.
I can take a first stab at that, and Dr. Cieslak, if you want to add anything, feel free. So ideally, you'd wash a mask every day or put on a new fresh disposable mask every day. That's really ideal, just prevent contamination, and it's just nicer to have a clean mask. Also, a really dirty mask might not be as effective at filtering particles, including the droplet containing the virus containing droplets. Any mask, I think it's safe to say, is better than no mask. So even if you're not able to get a new mask or clean mask every day, it's still better than nothing. We also think that the transmission by what are called fomites, contact with hands and objects, including masks, is not the primary means of transmission for COVID, but it certainly could, in some cases, be a risk. So I think we'd say that any mask is better than no mask, but we really would encourage clean or fresh masks as much as possible.
Thank you, Dr. Jeanne. The next question comes from Rosalie, who asks, I went to the dentist 2 weeks ago and they didn't have masks on in the reception area. Are they required because it's a medical type of place?
Yes, they are. Currently, masks are required for both patients and healthcare providers in healthcare settings, and a dentist's office is indeed a healthcare setting. So it would be good if you could remind them of that.
Thank you very much, Dr. Cieslak. Our next question comes from Sarah, who asks, since masks are being required in schools, the urgency to get our kids vaccinated has subsided since we will be mitigating risk with masks and social distancing. With a myocarditis risk, it seems best to take the wait and see approach when it comes to kids. Do you see this being a problem as we continue to try and reach herd immunity among the general population?
I'll take that one too. Great question. I do think, when you're talking about herd immunity in a population, you're talking about the overall population's immunity to a given infection, whether that immunity be by being vaccinated or by natural infection. And I think something like 13% of the population in Oregon is less than 12 years of age. And so because they can't be vaccinated at all, at least now, that puts the onus on everybody 12 and older to get vaccinated. So we certainly are strongly recommending that everybody 12 years age and older get vaccinated. The myocarditis risk has been looked at extensively, and we now have a couple of months worth of data coming in since the problem was first surfaced. And it is pretty clear that even with that risk, with the kinds of case rates that we're seeing today, and certainly where they're projected to go, you are better off getting the vaccine than not getting the vaccine. And if you are really worried about the myocarditis risk, then you do have the option of getting the Johnson & Johnson vaccine, which hasn't been associated with that particular risk. But even the other vaccines, the risk of myocarditis is much lower than, for example, your risk of being hospitalized with COVID-19.
I would add to that, Dr. Cieslak, that most of the cases of myocarditis that we've seen have been pretty mild. And so even for those children who were hospitalized with myocarditis after an mRNA vaccine, most of them did pretty well and were discharged with a mild infection resolved. And also don't forget that COVID-19, the infection of the virus itself, can cause myocarditis. And in fact, that could be an even higher risk than the vaccination. So I don't think it's even necessarily true that the vaccine presents a higher risk of myocarditis than not getting the vaccine.
Thank you, Dr. Jeanne. And it looks like we're running out of time. So is there any final remarks either of you would like to share with our audience who joined us today?
I would just say thanks for all the great questions, everybody. Really, really good to see the engagement here. You know, if you haven't been vaccinated, that is absolutely number one, the most important thing that you can do to protect yourself and to protect your family and to protect everybody. Thanks.
Thanks, everyone.